Hi guys, myself Dr. Revati here, consultant pediodontist and proprietor of Dentitia multi-specialty dental center. Today I am going to discuss about traumatic dental injuries which can occur in children and teenagers, wherein loss of tooth causes lifetime consequences. So I will be discussing about one such interesting case which was reported to our center the last August. So the patient name was, and he was around 8 years old. He was quite interested in skating, and unexpectedly he met with a trauma. He went and hit an iron rod. So all his lower front tooth were extruded. Okay. So we received a call from the nearby hospital. So the plastic surgeon spoke to me and he wanted to address the issue. The patient was 8 years old and accidentally he hit an iron rod. The incident took place in the school, and the accident spot he lost two lower teeth. One was deciduous and the other one was a permanent tooth. And 3 lower incisors were extruded. The patient has transferred to nearby hospital and OPG was taken. I received a call from the plastic surgeon of that hospital who requested me to save the lower 3 permanent incisors. So we planned for stabilizing the permanent tooth under general anesthesia. Extrusive luxation is displacement of the tooth out of its socket in axial direction. Clinically, the tooth had increased mobility. Radiographically, the periodontal ligament space was increased. We repositioned the tooth by gently pushing back it into the socket and stabilized the tooth for 2 weeks using flexible splint. The patient was kept under follow-up for every 2 weeks and watched for any unfavorable outcomes. Since all the stabilized lower incisors were immature teeth, there may be spontaneous pulp revascularization. Thus, root canal treatment was avoided unless there is clinical or radiographic evidence of pulp necrosis on follow-up examinations. It's been 9 months of follow-up without any unfavorable outcome. Each follow-up includes questioning of the patient about any signs and symptoms and clinical radiographic examination and pulp sensitivity testing.
Hi, I'm Vivan's mother. I work in software private company, and my son was very much interested in skating. So I have enrolled him in post-school activity in school, and he was very much interested in the sport. So we were encouraging the sport. Suddenly one day there was a bad incident which happened in the school, wherein he was injured very badly. There was an incident which, like, he was in a very speed race. One of the student has come in between and he couldn't stop his skates, and he has fallen very badly, and all the teeth has been injured. Most of the teeth, like around 7 teeth, has been injured, and we have immediately taken him to Kaveri hospital and admitted him. After admitting in the hospital, plastic surgeon has advised us to contact a pediatric dentist, and he has advised Dr. Revati is a pediatric dentist who is available as now. So we have asked him to contact Dr. Revati and team. So Dr. Revati and team has been contacted, and they have reached the hospital in time and treated to the best. We have suggested for taking an X-ray, which is really mandatory that time, and all the 4 teeth, like permanent teeth, were damaged very badly. So we have gone through all the process which doctor has said, and we admitted him for nearly 2 to 3 days in the hospital, and he has undergone operation in the midnight under general anesthesia. But we have to strictly follow the rules which doctor says us before the operation. And general anesthesia is not a bad thing. It is good for kids also. You can follow the instructions and take the general anesthesia and come over the incident whatever you face. After the surgery, he has lot of chills. With the help of the doctors, the chills has been controlled. Then he has been shifted to the room at around 2 o'clock in the morning. After shifting to the room, we followed the instructions which doctors has told. We did not give him any of the food till next day. 6 hours we did not give any food. From next day, we followed the diet which Dr. Revati has advised. We have given him all liquid diet till 4 weeks. We are following up with Dr. Revati every 2 weeks in Dentitia.
Hi, my name is and I study in Vigor High ECT. I like skating and one day as in PSA I was in a race in which I was racing at full speed. And suddenly in the middle of a turn another skater came in between, and then I lost control of my skates and I got injured. I was admitted in a Kaveri hospital in which Revati auntie came to help me, and I was in GA for till 3 o'clock to 4, and the next day when I woke up I noticed a kind of wire in my mouth, and my front incisors were implanted, and now I'm able to eat properly since my teeth are not wobbling as much as they used to wobble when I was in the hospital.
At Dentitia Multi-Speciality Dental Center, we take a pride in offering expert dental services along with the specialization in pediatric dentistry.